All right, so we're here with Miss Cheryl. This is her second adjustment. So if you kind of zone in, when we first looked at her range of motion, when she bent forward, this part of her spine actually pulled towards the right. Long history of low back pain, but more of a recent here in the last 4 weeks, last month. Lots of sitting from the normal COVID stuff. So when we did the evaluation, we were looking at her lower sacrum and how it's balanced and also how it's moving. So what we found was this joint was back and down, causing a pull. And so if you can think of my new favorite toy, the biotensegrity model, everything is connected and pulling. So when there's some change here, there's going to be a change along that whole spine. So you have the bones and you have the ligaments. So when one side starts to pull, there's going to be effect all the way through. So our adjustments, we want to correct that restriction and that subluxation and allow that freedom of motion to take pressure off of the nerve. So the first one, lay on your left side, so you're facing me. Oops, sorry. So we're going to pull through this joint, let it come down, relax. Other side. Actually, if you want to come around here. And so here's where the lumbar, we're going to rotate up and over. Allow it to come down. Nice. Good. On your back. So that plays a role in how the leg lengths equal out and how the rotation of the pelvis will be. Okay, so the first part is the correction of the actual bone and the alignment and the movement. Second part, because of how the muscles are spasmed and can possibly be inflamed and have the chronic pull on it from the history of it, we use an actual, it's called an alpha ball. So this addresses the trigger point therapy or the stretch deeper around those muscles in the spine. So we put it right along the spine on the tight side and rotate the pelvis. And that puts a lot of pressure. You feel that stretch? So that gives just a couple minutes of the relaxation after the adjustment.
Go.
Okay, so the last part is we want to try and now mold that spine so it stays and holds the correction. So if you want to come around here, you can see the way that it was pulling her spine going this way, we're trying to do the opposite stretch. So it's passive where she can sit with that pull pulling through the actual lumbar spine where we did the correction. You sit here for 8 minutes afterwards so that you allow that long-term correction to happen. So we can get the long-term results and get rid of a lot of chronic low back pain.